So, biomarkers for C. esophagus, circulating tumor DNA as a biomarker. So, with the advent of next generation sequencing of tumor tissue, current technology can now assess blood for circulating tumor DNA as an alternative to tissue analysis, and data are emerging that persistence of circulating tumor DNA in plasma after curative surgical resection of gastrointestinal cancer may be strongly prognostic for disease recurrence. Investigators from the chemoradiotherapy after induction chemotherapy in cancer of the stomach, that is CRITIC trial, recently reported serial assessment of the circulating tumor DNA prior to neoadjuvant chemotherapy, after chemotherapy, and after surgery in patients with locally advanced gastric cancer and G junction cancers at baseline or at completion of neoadjuvant chemotherapy, and 30 of 50 patients studied had identifiable circulating tumor DNA, and of these patients 11 converted to negative circulating tumor DNA after chemotherapy. So 50 samples they were taken, out of the 30 was ctDNA positive and they received chemotherapy. After chemotherapy, out of 30, 11 converted to negative, and 19 patients had detectable circulating tumor DNA, including 3 patients who became positive after chemotherapy. 3 became positive after chemotherapy persistence, correlated with the higher recurrence and poor survival compared to ctDNA negative. All these 3 patients turned positive after chemotherapy, all developed recurrences. So pathological response to treatment at surgery, however, correlated with the absence of ctDNA in responding patients and persistence or development of ctDNA in non-responding patients. In 20 patients with the blood samples available after surgery, 11 patients who were ctDNA negative did not recur. However, 6 of 9 patients, so 20 who were whose blood samples received after surgery, 11 had negative CNA, but out of the remaining 9 who were positive, out of which 6 patients they turned out ctDNA. 6 patients this tumor recurred, indicating a higher recurrence in positive patients, but the potential for addition of adjuvant therapy after surgery to reduce the risk of recurrence. Also, the potential for additional adjuvant therapy given after surgery to reduce the recurrence. Another recent trial reported by investigators from UK profiled circulating tumor DNA in cohort of patients treated with neoadjuvant chemotherapy and surgery for esophageal adenocarcinoma using pan-cancer ctDNA panel evaluating 77 genes. After preoperative chemotherapy, 49% of 75 tested patients had evidence of ctDNA, and after surgery, in 77 patients tested, 16 had positive ctDNA, that is 21%, and 75% recurred. And when factoring in exclusion of clonal hematopoiesis with uncertain potential, of 63 patients, 10 were ctDNA positive after surgery, that is 16%, and 9 of this 10 recurred. So this data supports the presence of ctDNA, particularly after completion of neoadjuvant therapy in surgery, is a strong negative prognostic marker. And this emerging technology requires further study whether such testing is independent of other risk factors such as TN and stage at surgery, and whether the finding of persistent ctDNA is actionable, that remains to be seen. Now in the next segment we will see the treatment part.